Canada is a young, multicultural country. Each year, an estimated 250,000 immigrants choose Canada to call home. The number of newcomers accounts for almost 19% of the 34 million people of Canada. Historically, Canada has always relied heavily on immigration to grow and balance its population. One of the reasons immigrants choose Canada over other countries is because of the Canadian healthcare system. This is also known as Medicare. The Canadian Health Act, established in 1984, states that all eligible residents should have reasonable access to insured health services on a prepaid basis. This is based on the principles of universality and accessibility. In Canada, access to necessary healthcare is believed to be a basic human right. This act ensures that all Canadians, including immigrants and refugees, are entitled to universal and comprehensive coverage for medically necessary hospital and physician services on a basis of priority and not the ability to pay. Nurses are at the forefront of healthcare, and they need to acknowledge that there is an issue of barriers to healthcare access for immigrants. Nurses need to educate themselves on these barriers and the available resources for immigrants to help them adequately access the Canadian healthcare system. The longitudinal study known as the National Population Health Survey found that immigrants arrived in Canada with better health than their Canadian-born counterparts. However, as time progressed, their health status declined, leaving them at higher risk for chronic illness. Being legally entitled to access universal health care should not be mistaken with the reality, which is that many immigrants are denied of this right due to a number of barriers. Canada needs to address these financial, social, and cultural issues that impede immigrants from seeking health care. Currently, in BC, there is a mandatory 3-month wait period before new immigrants are eligible for provincial health coverage. This means that they are forced to pay for any medical expenses out of pocket, which can become financially burdensome. This can act as a barrier for immigrants to access health care. Despite the fact that Canada is multicultural, discrimination and marginalization are still a reality for immigrants seeking health care. Patients report experiencing negative treatment within the Canadian healthcare system, which leads to a hesitation to seek health care. Language barriers also affect access to health care in various ways. Immigrants may not be able to voice their concerns with healthcare professionals, which could deter them from wanting to reach out to them. Other issues include miscommunication, lack of interpreters, and family members acting as interpreters. In a report by Raplansky, 58% of surveyed healthcare providers stated that they experienced challenges with providing services to those who do not speak English. Also, 35% agreed that there was a lack of resources available to them to understand different cultures. There are a number of resources available to immigrants free of charge that nurses should be aware of. Since 1994, the Bridge Community Health Clinic in Vancouver has provided immediate access to primary and preventative health services for refugees, with or without legal status, and new immigrants. Primary health care services that the Bridge Clinic offers include screening for infectious and/or chronic diseases, immunization, chronic disease management, pediatric consultation, outreach health education, immigration medical examinations, mental health services, and settlement services. Another resource that both nurses and non-English speaking immigrants can benefit from is Mosaic. This multilingual, nonprofit organization is dedicated to addressing issues that affect immigrants and refugees in the course of their settlement and integration into Canadian society. They provide a guide to health and medical terms, which is designed for volunteer interpreters and people with English as an additional language. It is also useful for healthcare professionals who care for non-English speaking clients to facilitate communication. Also, while communicating and caring for our clients, it is important to maintain cultural sensitivity and cultural awareness. These are essential to providing safe and holistic care, and begins with the understanding that there are differences among cultures. Furthermore, this includes placing value on this diversity. Cultural sensitivity is a concept that is vital in the nurse-client relationship, especially when working in a multicultural environment. It is important that nurses remain tolerant and non-judgmental about clients' beliefs and practices, and to avoid imposing their own personal cultural values in this relationship. Nurses can strive to make changes in their communities by backing nonprofit organizations that support and empower newcomers through advocacy, public education, community development, coalition building, and bridging with the broader community. In February 2010, the government of New Brunswick dropped the 3-month wait for provincial health insurance for returning immigrants. Meanwhile, Ontario is looking into cutting the current 3-month wait time, which would eliminate a major barrier to healthcare access, along with the stress and potential financial burden. We call upon all nurses to get involved with the political aspect of the healthcare system. Nurses can do this by writing to their local members of parliament, as well as the Minister of Social Development, who is responsible for multiculturalism, and Minister of Health, to review the current wait time policy in BC.